Well, good day. My name is Jeffrey Lauer, and welcome to an Iowa review of federal programming, policy, and legislation that impacts people with brain injury, their families, and services in Iowa. We're joined today by the chair of our board of directors, as well as a longtime member of the United States Brain Injury Alliance Public Policy Committee, Janice Meagle. Thank you for joining, Janice. And we have a small group on the line today, which is not unusual. Policy wonks really only want to know about policy when they're ready to know about policy, and it's not exactly the first thing on most people's lists after lunch on a weekday. However, we're going to go over some things today, and this will be available for the next couple of months until it gets a little dated on our website at biaia.org, www.biaia.org. All right, I'm going to do a little background here on what's new and bubbling and what is on the radar screen for advocates for brain injury at the United States Brain Injury Alliance and with some of our partners. So good news first. The president signed just earlier this week the fiscal year 2022 spending bill. Big spending bill. Holy cats, lots of money. But it takes a lot of money to run a country. And that increases the funding for brain injury. And that's the first time that's happened in quite a while. It's an increase of $4 million from fiscal 21. And it goes up to not that much money. It's still decimal dust in the federal budget, but $15.3 million, which is fantastic because it will allow states that are on the fence or just can't be bothered by adding another program if they have to write a grant application. It'll allow some states to get some money to start doing a needs assessment or perhaps generate some pilot programs. And 15, maybe 17 years ago, when this program was first signed by President Clinton, this program was very competitive. Iowa competed with a group of, I think, 17 states that won out of a group of 30 that applied for funding. And Iowa, IOWA, is the only state in the country that has successfully reapplied every year and gained funding to increase our state capacity for brain injury services based on and funded by, in part, by these federal dollars. The state absolutely puts some money into the game, but that's as a result of the very first funding that came in, which helped do a needs assessment, asking people with brain injury and their family members, what do you want? And one of the first programs and projects that came out of that was the feedback from constituents that they needed information. They needed rapid, reliable, relevant information about brain injury. And I remember the quotes were for many people, and at the time I hadn't experienced it personally, subsequently, and since then, my wife and I have a daughter, adult daughter now, who had a brain tumor and has had 2 brain surgeries. And I can attest to the fact that even if you know brain injury, the information comes at fire hose pace. You're just washed over by information while your emotions are all jacked up, while you really just want to get your loved one home and safe and fed in their own environment to recover and heal. And then 3 to 4 months later, many of us, including my family, went, uh-oh, there's still stuff going on. And the Brain Injury Alliance put together a tote bag, a canvas tote bag with about $20, $25 worth of educational materials for people. And we've shipped more than 10,000 of those across the state in the last 15 years. They were wildly successful, and the state of Iowa, Department of Public Health, won an award from the Department of Health and Human Services for that program. The next thing that happened big in Iowa from these dollars was the basis for launching the flagship program right now, the Brain Injury Alliance, which is neuro resource facilitation, which has served over 10,000 people in the last 15 years. And that's through the Brain Injury Services Program at the state, which recognized that they needed to put some money into this as well, alongside the feds. And the state's put about $1 million a year in for 15 years. And that's pretty amazing. So at the federal level, the president has increased, the Congress has increased, and the president signed off on an increase for this kind of programming that the states can use with flexibility to try stuff out to see what works. Fortunately, now, 15 years later, there are evidence-based practices that states like Oklahoma, that doesn't have any of this money right now, or I'm just trying to think, I think Alaska doesn't currently have any funding. They'll be able to start thinking about deploying some additional programs for people with brain injury. That's terrific. Also, our surveillance nationally, meaning the ability to keep track of and know generally how many people per year are being injured and or acquiring brain injury, and what are the causes and what are the outcomes. And the Centers for Disease Control and Prevention has been granted a modest amount of money, $2 million, which we think is not enough. And we're asking them for the following year to bump that up to 5, to do some surveys, 10,000 or so random phone calls, to find out a statistically significant number based on Americans who've had concussion, moderate brain injury, severe brain injuries. So we're going to have some new data, and that's the first time we've had that in a long time. We can then extrapolate those percentages to the Iowa population and use that in a way that's much more effective than we have right now. Are there any questions about those two programs that have received some additional money, the federal TBI state partnership and the Centers for Disease Control and Prevention surveillance program?
What do we do with the money that we get from ACO? Because we get the state money. Now, what do we do with the money from ACO? What special programs do we do because of that?
The Department of Public Health receives that money. They're the ones who draft the grant. This last year, they worked with the Brain Injury Alliance to try to expand in a real significant way the state agency that looked like it was going to be merging with Department of Health, and now that's definitely happening. Our Human Services, Department of Human Services, and Department of Health are going to merge, and the Department of Health staff said, let's get those people understanding brain injury better and how a brain injury expertise can actually serve their constituents that they didn't even think about had brain injuries. So the first place that we got some traction, in which we started a pilot project with some of those funds, was, and June Klein Bacon from our staff has spearheaded this in a fabulous way. It's working with, you know what, June, you're on the phone, right? Or you're here with us?
Yeah, I'm here.
You don't have to go on, you can stay on or off screen, but it'd be great if you could give a 1-minute summary of the Child Welfare Coalition and what the goals of this program are that we're using the federal money to do.
You bet. So we have partnered with the Department of Human Services and the Department of Public Health, obviously, as the lead agency. And we are working to set up a pilot in 3 of Iowa's counties, Des Moines, Lee, and Clinton counties in Southeast Iowa. And we are going to be working to do brain injury screening for parents that may have their families involved with the child welfare system. And we're going to be working through a variety of steps that will include brain injury screening, offering that neuro resource facilitation program, and providing case consultation and technical assistance to those that are at the table through what they call problems solution focused teams, sorry, acronyms. And, you know, the hope and hypothesis is that we're going to be able to support families to stay together or reunify if a removal has already happened.
Thank you, June. So that's a first in the nation program that's come out of Iowa. June kind of crafting that with actually a national committee to put the project together. And it's using Iowa and many of the other states as kind of a experimental laboratory. I hate to, we don't, people are not lab rats, don't get us wrong. We're trying to do good stuff, but we're trying to see what works. What are the obstacles to helping, in this case, parents with brain injury with children, where the systems obstacles, are, and how to kind of do these, how to help people, how to serve people better to live well with brain injury. And the resource facilitation program is a classic example of that, where as it kind of came out of the gates in 2001, it was just a promising practice. And then after we started collecting data on the outcomes, that people were actually doing better, that the percentage of people didn't end up impoverished, in prison, homeless, on Medicaid, in out-of-state placement, in psychiatric placements, because of these services, then it shifted to being viewed now as an evidence-based practice nationally. And it's actually a requirement for many states who take some of these monies to build a resource facilitation program, because it's known to help. Another thing, Allie, that I'll point out for you that just came through, it's other legislation, but there's been a bill in the Senate introduced to accelerate research, educate long COVID patients, research on long COVID, coordinate education, employment, and schools on the impact of long COVID, chronic COVID, and then develop partnerships between community-based organizations, social service providers, and legal assistance to be able to better help people with long-term and chronic COVID access to services. So that's, you know, that's getting some visibility at the Senate level. That would probably not happen though until the fiscal year 23 appropriation, but it's coming. It's coming. No worries. Thank you, Neil, for responding. I don't mean to put you on the spot. I just want to make sure that any questions you have might get answered. Neil just chatted me back to a question that I asked him. So what's the point? The point of trying to have an impact as one of the collaborators in brain injury, and the big three are United States Brain Injury Alliance, Brain Injury Association of America, and the National Association of State Head Injury Administrators, each that has a slightly different angle on how they view their missions and their constituents. But we kind of agree that the goal is to have the federal programs which support a whole range of services from, as you well know, education, employment, school, healthcare, to have them continue to enhance and expand the state's capacity to provide services and supports for people with brain injury, to improve services for people with brain injury who are currently underserved, who might have like co-occurring conditions, mental health and brain injury, substance abuse and brain injury, be older adults with brain injury who are just considered, well, brain injury is not an issue, they're just old. Well, as I'm getting there, I can tell you, I don't want to just be old. I want to have my conditions focused on so that I'm not, swept under the rug before my time, although sweeping me under is a good thing to do eventually. And then people who've experienced domestic violence. Part of the funding that did come through as well from the president's signature, just as an aside, was spearheaded to some degree by Iowa's delegation, Joni Ernst. And that was, I'm trying to remember, that was the VAMA, what was that called? Women's Domestic Violence with Women's Act. And I don't have the exact acronym in front of me anymore, but that was funded as well. The other piece is to make sure that the safety net programs have brain injury on the radar screen, focused on kids and youth with brain injury, the maintenance of access to healthcare, trauma care, and rehabilitation, early intensive rehabilitation after brain injury. And then functionally to go upstream and reduce the number of brain injuries as best we can to minimize the effects and then to optimize the outcomes after they happen. That's what kind of the overall picture is. And this program that we keep returning to and talking about, which has been reauthorized every few years, is known as PL 115-377, but it's called the Traumatic Brain Injury Act, which was again authorized as the only federal program specifically addressing United States citizens with brain injury. And it's done a ton of good, and we want to see it continue to do good. So expanding funding for that, and that's already happened this year, but it wasn't as much as we looked for. Expanding funding for the Centers for Disease Control. And then there's one more piece I'll throw in, which is, hey, welcome, Jennifer. Jennifer Lynn just joined. Jennifer, just so you know, this has been recorded. So if you're in about a day, you can go back and catch the first 25 minutes or so, but thank you for joining us. The other major funding that comes out of the feds is the Traumatic Brain Injury Model Systems. And that's a collection of 16 medical/research centers that's administered by Health and Human Services and the Administration on Community Living. And it's the only source of long-term data on what happens to people with brain injury across their lifespan. And that long-term research is critical to identifying and designing future improvements in treatments. And so they do small studies and giant studies across 16 centers. And there's a ton of outcomes they've had. And so the other piece that we're urging Congress to do is to increase funding for these programs to go from 16 centers to even more. So going up by $15 million over the next 5 years to increase the number of multi-center TBI model systems collaborations, because they really do change the face of both acute care treatment and longer term treatment. Well, I've taken about 30 minutes of our time kind of giving a high level overview, but maybe from a USBIA public policy perspective, Janice, can you give folks a sense of, if they wanted to get involved as policy wonks, what they should be prepared to give or to sacrifice or to get from that process, and how that works?
Well, you're looking at like how we can be involved in our different meetings, how one can do that.
Sure.
Well, the part of any advocacy is local advocacy. And the biggest thing to do is to know who your representative is. And once you know who your representative is, then when we send out notices, which we do, and you go on the brain injury, what do you call that page? You call it something now different. Your page, when you send out what's going on in the brain injury world, you send a newsletter out. Your newsletter. What do you send out as a newsletter? What's the name of it?
Brainstorming, Janice. Brainstorming.
Thank you. Brainstorming. That's what I'm looking for, the word brainstorming. Okay. So that brainstorming, look on that, and oftentimes we'll say reach out to your congressional leaders. And that means not only know who your state representative is, but you have to know who your House of Representative in Washington is. And then when we ask to reach out, depends upon what kind of funding we're talking about. If we're talking about something locally in the state, then it's good to know who your state representative is and who your state senator is. in Iowa. And then, in fact, if you were looking at something national, like when we look for more money in all these programs that Jeff was talking about, you need to know who we have 4 House of Representatives. We have Hinson, we have Miller Meeks, we have, I never can say his name right with an F. Say his name for me, June. Feasta, and we have Cindy Axney here in my district here in Des Moines. So the North, if we were asking you to reach out to somebody, if you live like in the northeast part of Iowa, that would be Hinson. If you're in the central part of Iowa, would be Miller Meeks. Des Moines and southwest would be Cindy Axney, and Northwest, and a big part of Northwest, even though we've had a lot of redistricting, is Feastra. So if you know that, then you go onto the email and you look the name up, and there's always a website. And all you have to do is send a note to that website. Now, if you want to get even more interested, the Brain Injury Alliance has what we call a Brain Injury Alliance. What was our group called? Like a task force? That we meet every day with Kerry?
The United States Brain Injury Alliance, right?
Right. The United States Brain Injury Alliance has a task force on legislation, and we're always looking for people to join that, but it's the national, not the state.
Public Policy Committee.
The Public Policy Committee, thank you. And I call it a task force, but it's actually a Public Policy Committee. And people like Jennifer or Allie, if you're interested, we would invite you to come on and listen and see, because you don't necessarily have to be, let's say everybody is by default able to listen in to any of our committee meetings. So even if we have a board meeting, you're welcome to listen in on the board meeting. You just can't speak. But also what we've done, especially in the United States Brain Injury Alliance, we have allowed non-board members to join our committees to be advisors. So if you're interested in that. Now, is that what you're looking for, Jeff? What we do for advocacy and how I wasn't quite sure.
Right, no, exactly. I think this morning we met with the health policy staff person and I for Representative Hinson.
Right.
And I noticed that you said something that caught her attention. You dropped a little bomb saying, by the way, my family is from your representative's district. We had a family reunion last year, and how many people showed up?
250. 250. There were Gherkins, Gerkin, and there was 250 of them.
And you could hear her breath go, oh, this is not just a constituent, this is a super constituent. Right. And
they all come from Dyersville and Dubuque and all around that, all the small towns around there, yes.
But that concept of being able to both like you do, tell your story in a succinct way, why this is of an interest and affected your life, and then you've taken it vertically through Iowa, and then now nationally, and there can be, if people want to, any of us can take a small amount of time and just get into being kind of a pesterer of a single representative saying, remember, I've been asking you to do something with brain injury for 3 years and you haven't even written me back, you ding dong. And
they will though, but sometimes they will. And then once you can call, you on the web, you can look up somebody's phone number, and somebody answers the phone and say Representative Hinson office. And then you can ask them for the email of the person that handles brain injury, which would be medical issues. And then you can direct that notice to that person. They will give out AIDS email, and they will give out the email, of course, for the congressman, but they'll also give out the AIDS email. And if you say, I'm a member of the Brain Injury Alliance of Iowa, and I would like to ask the congressman to do something, and I would like to send a letter to that congressional aide that covers this subject, whatever the subject it might be, they will answer you. They will say, I've received your email, because I was telling the girl today from Hinson's office, I did legislative work for the National Association of Postal Supervisors for 20 years. And when I started out, you use phone calls. Well, now you don't use phone calls, you do email. Well, I found out that when you first sent email, they answered you right away because they weren't getting thousands of emails. Now that you might have to wait a while, but it was interesting because when you called them, you oftentimes got them, right? Because they didn't know who was calling. Let's say, who is Janice Meagle? Oh, maybe she's an attorney for somebody. I don't know. I got to talk to her. You know, so the email is less personal, but they will answer you. And sometimes they have an automatic call. You do that on email. You can have an automatic answering thing on email, and sometimes you'll get that. But I find that these young people, and they usually are young people, they want to do a good job. They're being reviewed all the time, and they're always looking to go up in their organization. And it means once they're in the low end of the totem pole, and then they work their way up to be the primary aide to the congressman or senator. So they want to do a good job. And it often helps if they have helped you in any way. You send the congressman a thank you note to say to that congressman, wow, Ellie did a wonderful job for me on my subject. She answered me right away. She gave me the answer that I needed. Okay, Congressman Hinson, I'd like to thank you, and make sure you keep Ellie on your staff because she's great. And I think that helps too. So thank yous always help. Connecting always help. And stories always help. Can't hear you. Can't hear you.
How's that?
Good.
Good.
Okay, got you now.
All right, we've got a few folks here with us. I can ask you specifically, unless you go ahead and cut yourself off, and I can't ask you anything. But does anybody have a specific issue or interest in either state or federal, in this case, legislation, or the way that policy is administered that either provides services or gets in the way of providing services? Because those are places that we try to lean into at the federal level. Welcome, Roxanne. Those are as we lean into. So this would be a great time to ask questions if you had any. We don't have to take the full hour. It's okay.
Just remind the people that came on, Jeff, that we recorded all this so they can listen for the last 45 minutes.
It's supposed to be kind of an orientation to the federal landscape for brain injury at the moment, and then maybe provide some context for what folks will hear if they tune into the Federal Congressional Brain Injury Task Force, which is having an awareness day, a series of presentations starting in about a half an hour.
Hey, Jeff, do you have a one pager of the federal issues that you can send out?
Yes, I will do so.
I just want to, because I just want to make sure some of those issues are on the radar of our national advocacy team as well.
Thank you. Good. Yes, please, Jennifer, take yourself off mute and go ahead and ask.
I think a lot of people know my issue is work comp.
Yeah.
And I enjoyed the articles that Ali you sent me yesterday, and I'm sure you had something to do with that. And I am interested in being on the advisory board. I'm in a unique position, being a mid-level provider, or at least I used to be until I had this brain injury. So it looks like they're already doing some work on work comp, but yeah, it's definitely a burden to the taxpayers when insurance isn't covering what they should be.
Yeah.
For brain injuries. And since I've been on pain concussion, I've noticed how many women and how many nurses it's really affected. And it's a lot more than I would have thought.
Well, you would be most welcome to attend the public policy meetings. That's kind of how you dip your toe in. And this is like every nonprofit I've ever known. If you show up 2 or 3 times in a row to a committee meeting or a board meeting or a task force meeting, people will just go, oh, there's a keeper. And so, Jennifer, you've got Allie's contact information?
Yep.
Yep, I'll push to her the date of the next USBI public policy meeting, and she'll remind me if I don't do that by the end of the today. Thank you, Ally. Oh, between the
I
two,
think I have it. I think it's in April.
Yeah, it's the third Wednesday of every month.
thank you,
Okay,
Janet.
So
maybe I
it'd be
don't have
April
it.
20th, because it was supposed to be today, but we have so much going on. It's the third Wednesday of every month.
What time?
Okay.
10 o'clock in the morning, our time.
And there's a web link that comes out, and we'll do quick introductions. And I'll be real frank with you, Jennifer, this is the first year. That's not true. It's been building incrementally. Our public policy committee suddenly went from like a scooter to an actual car that's enclosed and can withstand rain and has cylinders and distance and mileage, and it's pretty impressive. So we have been playing much more of a role at the national level, and with your experience, and I think particularly the collaboration with the Pink Concussion Group is, that group has gained a tremendous amount of visibility, credibility, capacity, and clout. And so if you can help us reinforce some of those issues, A, with women, and then B, or even B, with it doesn't matter. On this issue of unemployment and how the companies try to dodge the costs. I think that's what I hear you talking about. Is that correct?
Right. Workers' compensation, which is the insurance company.
Yeah,
But, and it also kind of goes into, and this may be something that is out of our scope, but into the medical manual that they use to diagnose concussions and brain injuries. And it looks like 15% of brain injuries are covered under work comp, which is a very small number. It's barbaric when you read the history of it, how it goes back to 2000 BC Prussia. And it really hasn't been very much modified since the 1910s until they did that thing here in Iowa in 2017, where they kind of dialed it back. And for every $100 they're paying, it was about $1.80. At times it's gone up to less than $3 per $100 for premiums on work comp plans. That's still very low. So they're thinking, well, we want to make this easy for people to come here to Iowa to start businesses. Well, we have more than enough. The builders can't keep up with all the buildings that Microsoft and Google and Facebook want. We don't have the people here to build them.
right.
But yeah. So I think we've definitely, made the grounds pretty fertile here in Iowa for companies to move here, but I think we need to take care of our Iowans and not put the burden on Iowa, on our public, I'm losing my words here, Medicaid and Medicare for taking care of these people like me, when this should be work comp who's reimbursing me. And my brain injury was kind of subtle and not really recognized right away. And it was kind of one of those things of exclusion as time went on. And so I'd like to kind of work with, DMU or, who's training our doctors, they need to recognize these things, but then it also needs to be in their textbook because that's how they operate.
You're right.
They go off the gold standard.
That would be helpful to see, and there may be a hybridized, if Iowa is reluctant, as it is a conservative business friendly state, it might be that the federal government, either through legislation or policy change, could start tweaking those systems a little bit, particularly as we get larger and larger numbers of people with brain injury advocating in the coming years.
Right.
Good.
Yeah, it's going to be a long, long fight. I mean, I'll probably be dead by the time it changes, but I'll try.
I thought that early in my career, and as I've been doing this 30 years, and there's still so much, so much that needs to be added or fixed, but there's so much more than there used to be for people to get connected and stay connected, depending on where in the state they live.
Mhm.
Affordability, availability, all those things are difficult. But none of us are in this to probably fix our own situations. Mostly we're doing it to pay it forward, like I hear you saying you'd probably end up doing.
Mhm.
No, that's
And
all.
when you think about it, from when my husband died in 1980, so much more is available. I mean, look at, they increased some of the VA funding in this new sign off today too. So, I mean, you don't think it's going to change, but it just changes so small. But it's like what's that? The rabbit in the hare? Who's the two people that one was called?
The
The turtle in
tortoise.
the hare. Yeah, the turtle in the
Yeah.
hare. It'll happen. It just takes a while. It'll happen.
Jennifer, where in the state do you reside?
In West Des Moines.
Got it. Good deal. Thank you.
Yeah, because you were talking about, a lot of people don't know they're trying to build Facebook over in Altoona unless you live around Des Moines. Yeah, I figured you did. Yep.
Well, kind of put last call out for questions because I want to give folks at least 5 or 10 minutes to regroup who may be going to log in again for the next webinar, which is about 2 hours. And it'd be great to get a snack or a bathroom break. Any other final questions or comments?
Jeff, are you still on the National Alliance Legislative or Policy Committee, whatever you call it, with the national?
I am. I show up there as regular as I can. Janice has never missed a meeting.
Oh,
So
you're on it too, Janice? Okay, I was just wondering. I thought you were, but I wasn't for sure. Are you keeping dibs on I believe there's a bill at the federal level to increase the $2,000 limit for Medicaid? I know a lot of people with brain injury are on Medicaid, and
I think we
I
have
had another
somebody.
meeting for the first half of this, so I missed it. So I don't know if that was one of
We
the.
have two people that actually are legislative people that work for, like, Brain Injury Alliance of Iowa isn't big enough to have its own legislative aid, but there are two people, and yes, there's a fellow in Minnesota on this committee, and also one in New Jersey, and they really can put their finger on the bills and watch it. So when we have our next meeting, I'll make sure we mention that.
All right.
Okay,
Great,
And-
thanks.
so it's an increase over the $2,000 for the
Yeah,
Medicaid.
having
Yes.
more than $2,000 of assets, we're just running
Which
into
is
that
really
with our.
stupid. I mean,
Well, we're
you know
running
what
into that
means?
with, we're running
You
into
can
that
have
with,
two cell phones. You can only
Well,
have two cell phones, yeah.
we're running into that with her daughter who turned 18. We're going through all the transition stuff. She's on the brain injury waiver, but she's working and she's getting competitive pay, and we're going to be increasing her hours. And anyway, it's just, yeah.
Roxanne, as a quick aside, and I can't imagine you're not well aware of this, but the Iowa ABLE and the National ABLE.
Yeah, already opened it, and that's what we're doing. But
Got it.
National law. We need something nationally.
yeah.
Well, that
And I see that there was a bill out there, so, and I know a lot of people are impacted by that, so.
well, even if they doubled it, we still, that's chump change, $4,000, $10,000
Right.
to save. So I know a number of people who've been able to utilize this new ABLE Act, which allows them to save up to $100,000.
Right.
And use that in really fundamental and functional daily living expenses. So, but it's more paperwork, and it keeps you from losing it keeps you from losing the eligibility for some of these public.
Right.
Such as
Right, such as the waiver, yeah. Yep.
All right. Well, I'm gonna give us. I made a commitment to give us at least 10 minutes between. So thank you all for joining today. It's a great pleasure, and have a terrific rest of your afternoon.
Thank you.